At the outset, I would like to extend a warm welcome to all of you and express my thanks and appreciation for your participation in today's resource mobilization meeting jointly organized by the Organization of Islamic Cooperation and the Islamic Development Bank. Your presence is a testimony to your commitment to the cause of global health and to the ongoing international efforts against the Ebola epidemic. OIC shares the international concern over the loss of human lives and sufferings caused by the current outbreak of Ebola virus, which has been declared a public health emergency of international concern by the World Health Organization. We're also aware of the scale of adverse socio-economic impact of the current crisis for the affected countries. Two of the most affected countries are members of the Organization of Islamic Organization, namely Guinea and Sierra Leone. Though our effort and sympathy goes to all those countries that have been impacted by the disease. I take this opportunity to convey our sympathy and support for the people and governments of all these affected countries. I would also like to express our deep appreciation for the laudable efforts and dedication of the health workers performing frontline duties and other staff, volunteers involved in the on-ground operations in the Ebola-affected region. They are providing us with example of courage, of dedication, and of true volunteer work. We remain fully aware of the enormity of the challenge and the need for more sustained and concerned international action to deal with this epidemic. We understand the imperative and urgency of scaling up international assistance in terms of financial resources, trained manpower, and medical supplies and equipment. On behalf of the Organization of Islamic Cooperation member states, let me assure you that we are fully aware of our humanitarian responsibility to come forward and contribute to the ongoing efforts against Ebola. We expect this meeting, inshallah, to result in the announcement of a tangible package of support for addressing the various dimensions of the challenge posed by the ongoing Ebola virus disease outbreak. Since the Ebola outbreak earlier this year, the OIC and IDB have been maintaining close liaison with the Ebola-affected countries and international partners, including the World Health Organization. In May this year, following initial contacts by Guinea and subsequently Sierra Leone, the OIC made a formal appeal to all member states for their support in the fight against Ebola. In terms of financial resources, supplies, health personnel, and expertise. The relevant OIC institutions were urged to set up their capacity building and training activities, keeping in view the specific requirements of Ebola-affected countries in terms of monitoring, early detection, surveillance, contact tracing, disease prevention, and control. The IDB, the Islamic Development Bank, approved emergency assistance grant of US $600,000 to support Guinea and Sierra Leone and the international efforts in that regard. As an immediate response, IDB has subsequently extended financing facility to Guinea to around $34 million for strengthening its health systems, out of which US $6 million is embarked for the Ebola control efforts. As a part of OIC efforts to sensitize the member states and mobilize their support for the Ebola-affected countries, a meeting of member states was held in Geneva on September 29, 2014. The meeting, which was chaired by the Minister of Health in Indonesia, was attended by a large number of OIC member states. The briefings provided by the Director General of WHO, Dr. Margaret Chan, representatives of Médecins Sans Frontières, MSF, and affected member states contributed to a much better understanding about the scale of the challenge cases and projections, ongoing international efforts, and needs assessments and gaps. Excellencies, ladies and gentlemen, Ebola cases are continuing in West Africa, resulting in daily death and adverse socio-economic impact for the affected countries. Health workers are becoming infected and dying. Entire health systems have been placed under tremendous stress. Their capacity to deal with other diseases and health conditions has been severely compromised, thus multiplying the negative consequences for the people. Patterns of work, business, and food supplies under threat as well. While the international community is coming forward with assistance, there are critical gaps in all aspects. In its briefing on October 15, 2014, the UN Mission for Ebola Emergency Response warned about an expected increase in caseload to approximately 10,000 cases per week by December 1st, if the existing rate of increase in infection was not checked. The World Health Organization is exerting efforts to reverse the crisis by putting in place the capacity by December 1st to isolate at least 70% of the EVD cases and safely bury at least 70% of patients who die. The ultimate goal is to have capacity in place for isolation of 100% EVD cases and 100% safe burials by January 1st, 2015. For the realization of this roadmap, money is required. However, beside money, there is an urgent need for staff, trained workers, and logistical support. The United Nations has called for diagnostic laboratories, transport support, funding for construction of new facilities, and foreign medical teams to staff them. We look forward to the briefings of the representatives of the affected member states who are with us today, the World Health Organization and other international partners with a presence on ground, including the MSF, with a view to assessing ways and means in which the individuals, philanthropist organizations, NGOs invited for these meetings, and OIC countries and institutions can contribute to the ongoing international efforts. I am sure that we will be able to come up with a tangible package for supporting the international effort against EVD. It is our historic responsibility to act. I urge all OIC member states, NGOs, philanthropist organizations, and individuals to follow the lead of those who have committed to join the fight against Ebola with concrete contributions. I also appeal for the immediate implementation of the pledges. We as OIC countries cannot be on the back seat in the fight against Ebola. We cannot be in the waiting room watching our brothers and sisters in the countries affected go through this disaster without showing up, being in the front line, being up front in that fight. It is for this reason, for this commitment, that we hold this meeting. May Allah subhanahu wa ta'ala guide our steps and provide us all with His blessings and ajr wa thawab. Wassalamu alaikum wa rahmatullahi wa barakatuh.